fasting, Sawm and fasting, and the month of Ramadan. So the last topics that we discussed were the 10 things that break the fasting. Then we started talking with some details about them. So the 10 things that break the fasting, the major categories are: number one, what comes inside the body, the cavity, the body, the abdomen, and all of the organs, what comes inside them from the direct way or indirect way, we'll talk about that, and what comes, of course, from any passage, from any hole in the body. So the front and the part will be number two and the three. The front and the part of the private parts, anything that goes inside them, including telescopic procedures, anything will break the fasting. Then we have the losing the mind fully, falling unconscious completely, intentional vomiting, intercourse, intentional ejaculation, menstruation and postpartum bleeding, and finally apostasy. Last time we talked about things that come inside the body from the natural passages of the body or holes, and we said they break the fasting. And the inhaler is a debatable issue. To be on the safe side, avoid it because it breaks the fasting according to scholars, some scholars. Now, what about things that come inside the body but not from the regular passages? We mentioned something about it yesterday. So, what if through the skin they have a blood coming, transfusion, blood coming to the person? This breaks the fasting. It is, although it is indirect way. The passages are for food and drink and medical, but this is coming inside the body from the skin. It breaks the fasting. It is a huge amount, and it comes inside the cavity of the body. This is different than injections, right? We mentioned insulin and other injections in the muscles, vaccinations. These, number one, they are not coming from the natural passages of the body. Number two, they are not going directly inside the body. They stay in the muscles usually. Insulin, also needles or injections. Uh, what about dental work and other things? Dental work and other things. I skipped something yesterday. Dialysis. Dialysis. They take the blood out of the body, then they clean it, filter it, then they bring it back, and they add usually chemicals to them. That breaks the fasting. So the person, if he is able to fast, he fasts. If he cannot, and somebody has chronic disease that he cannot, or it is less likely that he will recover, then he feeds a person. One mud, full hand of food, feeding a person per day. We'll talk about later on, inshallah. What about other things that we have to avoid, and there is a possibility that they will break the fasting? Dental work. This is among the questions that always people call me about in Ramadan. I am going to try to make it out of Ramadan. If you have the ability, just postpone it out of Ramadan. If there is a need, then do it in Ramadan, but you have to be careful. So Rasulullah Sallallahu Alaihi Wasallam allowed people to rinse their mouths in wudu, right, and to throw it. So to put the food, but should not go beyond the throat. You have to be careful. It is not recommended and it is disliked to exaggerate and go so far in rinsing the mouth. Why? Because there is a possibility that something will slip. And also the dental work, there is possibility that something falls. Usually, you're opening your mouth, and so try to avoid it. But if there is a need, then you can do it. Make sure that you rinse your mouth. No blood after that goes inside your mouth. Make sure that everything is clean. If it happens by mistake, inshallah, Allah Ghafur Rahim, it is out of necessity that you went to the doctor. But if there is possibility, just delay it. Toothpaste, we mentioned that. Scholars say if exaggerating in madmada is disliked, also toothpaste is disliked. Just finish your food. Among the things that I wanted to talk about the time. Try to finish your sahur 1 or 2 minutes so you can floss your teeth, brush them before the adhan. This is the solution. Toothpaste, all of that before. What about swimming and taking a bath? It is fine, right? Although the skin will absorb some of the water, right? But it is indirect and it is small amount, right? So you distinguish between anything that you put on the skin with a medicine or skin lotion or something that will be absorbed but a small amount and it is not direct passage to the body. So try, it will be fine. Swimming is more dangerous possibility, especially somebody's taking classes still. It is a possibility, so to be on the safe side, avoid it. Taking a bath is normal, no problem with not taking a bath. Just keep your mouth closed, unless if somebody has the habit in front of the bath. Okay, lab work, the blood coming out. It is a small amount and it is not coming in, it is coming out. So it is tolerated. In Shafi'i madhab, at least it is tolerated to go. To donate blood is not recommended medically, but you can do it. The problem is getting something to strengthen your body. Getting like a blood, getting food, getting IV or nutritious. So these are the things that break your fasting. Things that you have to be careful also from: smelling deeply and directly bakhur, incense, and perfume, or food or other things. Some scholars consider bakhur incense will break the fasting because you stand there and some small particles will go inside you, so you have to avoid direct smelling. Also, these colognes of alcohol that people spray, not oil, there are two types. The oil will be fine, but the other one, because alcohol usually spreads, so direct smelling is dangerous, so try to avoid it or not to do it. However, if somebody applies it himself, it will be fine. Okay. What is the kafara if somebody breaks any day of Ramadan? We know that if unintentionally or somebody does it for a need, you make it up, right? But what is the intentional, what is the punishment or the sin for the one who is intentionally breaks a day in Ramadan? Some scholars say if he fasts all of his years and days, that will not be enough to make up for one day of Ramadan. Kind of exaggerating and pushing people away from it. Some others say it requires tawbah, and making up that day of Ramadan. Breaking the fast through intercourse, sleeping with the wife. This is the worst punishment for breaking a day of Ramadan. For one day, how many days he has to fast? 60. It is the punishment of the dhihar. You have to emancipate a slave. For one day, emancipating a slave. We don't have slaves. Then this is the contribution of Islam to solve the problem of slavery. Then number two, fasting 60 days for that one day. And if somebody cannot do the 60 days, then to feed 10 poor people. 10 people to feed them. The monthly cycle. Now there is something that sometimes like girls reach the age of puberty and they have the monthly cycle and they feel shy. They observe fasting. Will that fasting count? No. Even some scholars say if intentionally she does the intention to fast the month of Ramadan, then this is a sin in itself. When Rasulullah ﷺ says that they should break their fasting and somebody is challenging that. So she has to make up that day or these days. Even if the period starts late in the day, she was fasting for a couple of hours or 10 hours or 9 hours, then she has to make up for these days. Falling unconscious, we did not focus on it. Falling unconscious, some scholars said it is like sleeping, doesn't break the fasting. But others said it is beyond and more than sleeping. Sleeping, like if somebody makes a noise or touch him or something, he wakes up. But the one who is falling unconscious completely, that will break the fasting, and you make up these days when somebody comes out. And that means if somebody is in a surgery, they have falling unconscious completely in the surgery, he has to make it up. Wallahu ta'ala alam. Sallallahu ala sayyidina Muhammad.
What about the niswa?